thank you both for being here with us. So, Phil, first of all, what are we hearing right now from the White House? What are they saying about his current condition?
Well, the White House, and more specifically, President Biden's doctor, told us this afternoon that the president is here in Rehoboth Beach. His wife is here too, First Lady, but the president is isolating. He does not have a fever. His vitals are good. He does have these mild upper respiratory issues with a cough and a runny nose, but he doesn't have a fever, and he is otherwise fine and doing the business of the American people just in an isolated way here in Rehoboth Beach.
And Dr. Kroll, you were with me yesterday when we learned that he had been diagnosed with COVID. Is our understanding that the president is still experiencing some sort of mild upper respiratory symptoms associated with COVID. We also know that he has been treated with Paxlovid. So how does having COVID with his age of 81 and his schedule, all of that affecting him, do you imagine?
Well, Kayna, look, anyone who's sick is not going to perform at their best. Obviously, they're going to feel sluggish. They're going to feel tired. There may be some mental cloudiness. As we get older, it is increasingly difficult for our brains to compensate for the stress that they're under when the body is fighting an infection. And so for older patients, we do worry about them having higher risk for things like not performing at their best and not feeling cognitively fully themselves. I will say this, though, just like we know that while older patients are higher risk for severe COVID, not every older patient who gets COVID goes on to have severe symptoms. While older patients are higher risk for developing maybe some neurologic symptoms when they're sick, not every older patient will go on to do that.
And can I follow up with you, Dr. Kroll, because we're hearing from our White House team and from our politics team that, staffers are describing him as being exhausted, wiped out. There are certainly rigors of the campaign trail, but, the president can't continue to have excuses for his health. At some point, people are getting very, very concerned. And you were with me yesterday as we watched him walk up the stairs onto Air Force One. And then there was video that came out last night of him getting off Air Force One and getting into the car. And if you had a chance to see this, Dr. Kroll, as you're watching this, what's your analysis here of what you're seeing right now?
Well, Kayna, he certainly looks slow. It looks like he's being extra cautious. We're just looking at him from afar. I'm not his doctor. I'm not in his orbit, so I can't really speak to exactly what he's feeling and what might be behind that sort of slow ascent up the stairs. But certainly any patient is going to be moving a little more slowly and thinking a little less clearly than normal when they're sick. And it's certainly possible that's going on for the president.
All right, Phil Lipoff and Dr. Leah Kroll, thank you both for being here with us. We have a lot more special coverage now from the Republican National Convention here